News Zoom room where Dr. Hoa Nguyen of the Physicians Advisory Group is standing by. Good morning, Doc.
Good morning, guys.
Good morning. So,
Good morning.
But let's just get it out of the way real quick. I know that you had messaged a
Okay.
lot of people about Dr. Akimoto's outburst yesterday with the comments, very hurtful comments that he had made. And did you want to just address that right off the bat, Dr. Nguyen, so we could move on to everything else?
Yeah, guys, I know on behalf to all the physician and provider in Guam, we really apologize for the outbursts of one of provider yesterday. No one should do that on the air. But again, the deepest apology to Dr. Mancronia. She's working. I tell you, we don't pay her enough to work. That much, and she's really over. She works long hours every day, and every time we see her, we tell her get some sleep. So you really try your best, as everyone does. Everyone in public health does try their best, and um, we didn't anticipate the amount of surge that we have. So yeah, mistake make here and then, but again, the whole island trying their best. So you can't really pick at somebody like that. So again, apologize for one of our colleague, and again, I would like to say thank you for Dr. Manclonia for the work that she does. So that's all I say. I mean, it's a need to be okay. So um, um, I can't say enough for that. So
Right.
again, just Dr. Manclonia is working really hard, and I can't ask her to work harder than that. So my
All right.
hats off to her. Okay.
Thank you, Doc. Let's.
You're welcome.
Okay, so we had a big meeting last night, the Physicians Advisory Group, right?
Yes. Chris, let me bring up this thing real quick because in the next week or two, we're gonna have a very high demand on care on the patient in Guam. GMHER and GRMCER really get overwhelmed with sick patients, and they really need the patient, the people in Guam. The message that if you have mild symptom, call your provider. Get seen at clinic level, but do not go to emergency room because they really saturated at the ER with all the sick patient. As you know, we have like 38 admission now at the emergency room. So if you have mild symptom, cough and cold, go call your provider, call the clinic, and get seen in the clinic. Everywhere you go, it's going to be some wait just because we have so much patient at this point. But no, please, no, do not saturate the emergency room at both GRMC and GMH. You know, they need to concentrate on the sick patient. If you cannot breathe, you cannot talk, you have chest pain, go there, okay? But you have just cough and congestion and body ache, just go to the clinic as much as possible so that you don't saturate the emergency room at this point.
Doc,
And that's the message I want to get across to the people of Guam. So please contact your physician or get seen in the clinic level if you can, okay?
you called this a couple weeks ago when we started to see those really big numbers. You said, hey, hospitalizations are going to climb quickly, and they are. I mean, we have
Yes.
8 new people in the hospital,
yeah, it's 38 according to the
Yeah.
situation report from last night.
Yes.
right? And so
And guys, the sad part is might get higher before it get better. So again, just like the mayor say, I talked to Mayor Saras yesterday and asked for their help. And I mean, at a certain point, no, we really have to be very cautious on the family unit
Mm-hmm.
level. Okay, so everyone on this island need to concentrate on your protect your own family, and that's what we need to do.
Yeah.
Okay.
Doc,
Um,
what can
uh,
you
uh,
tell us though about we talked about the hospitalizations really briefly, but I think we need to talk about this a little bit more because where are we going to put all these people that might be rushing to the Guam Memorial Hospital in need of COVID care when we already have 38? And I know that it's a balancing act moving people in and out. Now there's a COVID 5 unit. Where are we going to put all these people? I mean, we
You know,
talked about tents. We got to wait for the Blue Med tents to be ordered. We have FEMA tents that are on island that we're not using. We don't want to use the military tents because they don't have this negative ISO pressure thingamabob thingy. So what are we going to do?
Because we're here now.
I think Chris is that, I think the talk is that the Guam Student Center, will be, is the second site to try to put the non-COVID patient there at the med-surg or med-tele level. So that way we can make room at GMH for more COVID patient. I know talk that they will ask for staff in the federal level to come in before the tent is set up. So there's a lot of things that are on the plan and they anticipate that. Is right now just ask for the federal level and everything to convert locally. But yeah, the second place is the Guam Student Center. That's what they are planning now. I know talk have been discussed for the past week or so, and I think that it's going to move in that way. And then other talk at the second site. I know SNU is not ready to be on the table, but I think other place, I can't tell you other place they have, but one of the hotel will be, will be tasked to be like the hospitalization until the tent gets here, and those are in the works. So
how soon are we
yeah,
going to see the surgery center? You said ready to go. When are we going to start moving patients out of the telemetry ward over to the surgery center? Because it's taking forever to get this super duper aircon chiller installed at the CIF at the SNU.
Yeah, I don't have the timeline, but you will have more likely the next week or so. You will see the probably Guam Student Center have to stand up. We don't slow down the admission.
Right. So the surgery center, they're going to use their own staff. Because
staffing wise, I think that it's going to be a mixture of everything. I think I don't know on the detail, but I know some of the staff get moved out, and I'm sure Guam Student Center will have some staff from the hospital, from both hospitals, will be augment that site. So the staff issue, Sabrina, I'm not quite sure, but I know that's the second site that they will open the next room at GMH.
Well, I'm glad that we're not going to sit around waiting for the SNF to be ready. So I guess that's good news.
Was there any?
Right now they cancel all the elective surgery only at Guam Student Center, only emergency only. So they are planning on that site, and I think that by next week, if this thing don't slow down, you'll see a big change.
Have they? What about the isolation? An update on the isolation facilities. So we have Days Inn and we have the Ocean Garden or Garden Court, Bayview Garden Court, I think. But we heard there was supposed to be. Well, there are talks about one coordinated isolation facility, kind of like how we consolidated the QFAX. We still doing that?
That question I'm going to leave public health behind me, so they will feel that I don't want to say something
like, no.
Well, it was Felix Cabrera, part of the PAG, who said that there was going to, there was an updated ISO
but I
facility.
Think they will have better answer than I can give to you. Okay?
Just make something up at this point, Doc. We don't care. Just take anything.
But the only thing that I want to tell people is that, from now until next Tuesday, we're going to have some limitation on testing. Okay, that needs to be out to public, and I'm going to ask public for some help here. Diagnostic lab reagent are running very low, so we will not run as much tests as we used to until the reagent come in sometime next week. So right now, what we like to do for the public is that if you're symptomatic, okay, then you can come into a clinic level and we can do some testing on a symptomatic patient. But if you're in close contact with somebody that's positive and you don't have no symptom, what we ask you to do is stay home, okay? If you have symptom, then come in and see someone, but stay home until at least next Tuesday, and you can come in and we can resume the close contact testing again. But do not come in if you don't have any symptom, because we won't test you, okay? That is prioritized on people that have symptoms. So please just stay home. Don't go to work. okay, until at least next Tuesday. And when the tests get back on the diagnostic lab level, then we can resume the close contact, asymptomatic, testing again. So come in only if you have symptom, and we will test you at that time. We need to do that. So really like to pass that message to the public, so that way, people don't come in and waste their time at this from now to Tuesday.
Doc, is this just on the private clinic side, or is this also something that's going on with public health that we're out of the
I think
reagent?
that come across the board from everybody. I mean, public health, DOS, GRMC, they all have their limitation, and we don't want to overwhelm the system at this point.
Right.
If you come close contact with someone and you don't have any symptom, you have to wait at least 5 to 7 days anyway. So in the meantime, just stay at home and do not come in. But come in if you have symptom.
Doc, I just have to ask that I got a message here. What about people who need to get a test for off-island travel?
That's a tough one. For the people that need the test to travel, we can prioritize them. There's 3 clinics that have the Abbott machine that can help you in those situations. Is that AMC, Dr. Gabo Clinic, and Dr. Clinic. So if you really need to have a travel clearance to go within the next 72 hours, then you can go to those clinic, and we use the Abbott, ID
Right.
to make sure they clear for the travel.
Bring your ticket, right?
Yes.
Okay.
Anything else talked
Okay.
about last night that we didn't ask you about?
Just come clean, Doc.
Okay. We talk about a new home quarantine. We need to start working on a new home quarantine program that we can monitor better regarding compliance rate. Because I tell you, one of the surge right now in Guam is because people are not follow the strict guideline of home quarantine. We have a few people that turn positive on day 7 of testing, and I tell you, by talking to those people, none of them stay home the first 7 days, and that's where the spread coming through. So, we will have to talk about new quarantine guideline, because we cannot continue the way we go with the home, Q factor for every patient coming in. So, either to some application on the phone that we try to implement, or come up with something. We don't have no detail right now. We just need to sit down with public health quarantine team with the PAC and work out a very strict home quarantine that help people responsible for when we're home quarantine and get tested in day 7. It's a total failure on that part.
Leche,
And
we're
we
already
learned
talking
from
about
the
home
first one.
quarantine when we're only 1 week into the lockdown. You just stay home
I
with
know,
it.
but
We're already.
yeah, we really have to start working now and make sure that we have the step, the enforcement that we can do. But like I said, it's very hard
Yeah.
to find somebody at this point. Just like the mayor said, man, it's just, if you don't have the teeth to enforce the quarantine at home, it's not going to work. People are
Yeah.
still going to
So,
go out
Yeah.
and
so
infect
we're
other
gonna
people.
have these in place before we just allow home quarantine again.
Bree, you have to.
Okay.
We felt the
Okay.
first time,
Okay. Just
and
wanted to make
I
sure.
wish, yeah, I wish everyone that really abide by the rule, okay, of the home quarantine. But unfortunately, a few people didn't respect other people, and they do the wrong thing. So we have to come up before we relax the quarantine in the hotel.
Well, that's good. That's good to hear that, we'll have some kind of enforcement provisions in place.
Right. I feel like this is something that they should have. I mean, when they had that bill in the legislature way back, I mean, I feel like this is something we should have done forward facing in anticipation. But again, the planning,
I also, Doc, we had on the mayors on, and Melissa Savares of Datado said she did have a conversation with you about, with them becoming snitches and all. But in the executive order, it does talk about these enforcement and fines and things like that. But it only extends to public health and to GPD. Why not extend that to the mayors if we want mayors to be snitches?
Yeah,
I shouldn't say
bring
snitches,
us
but
some.
to
Yeah,
tattletale
Keep saying
or
it.
yeah,
Keep
whatever.
saying it.
that's the wrong word to say.
Yeah, but you know what I mean. Like
Yeah,
to.
we know what you mean.
I know.
Sorry,
It
Bree's
really
gangster,
means.
Doc. That's the only way she knows. She doesn't know tattletale. She doesn't know informant. She just uses snitch.
Yeah, I know. We need the help of everybody. Public health by themselves will not be able to do this.
Right,
We need
right.
the help of the mayor. They're very powerful at their level. And so, I asked, Mayor Savares to, talk to mayor council. If we have to go talk to them, we will. And we ask them, please, just monitor the activity in your village to make sure that you don't have barbecue in the backyard, gathering and just go and talk to the people and say, hey, please don't do this. We all had to get out of the peak hole one somehow, but we need the help of everybody. So if we have to change things, the executive order for the mayor to have more power, then we do. But we really need their help in controlling this surge right here. So I'd like to thank you, Mayor Savares, for spread the word out to other mayor.
Right.
So thank you so much for doing that.
Doc, what do you think about? We just had a comment here, and we'll let you go after this. Governor needs to implement a curfew. All businesses close at a certain time. Get all the essentials you need. Do your errands, and everyone stay home.
Christopher, right now, like I say, the business like Payless or the Takeout restaurant, none of them have any breakout. And that's the part where I agree with the governor in open those business. So to take out food and Payless and the car auto shopping thing, they should be open because the right now really, if you want to control the breakout, the surge, control from the family level. You have to be known where the breakouts. You find people that positive, one here at Payless, one here at whatever business they have, but is that from home? It's not from the business. So control where the search is. There's a search right now at the family unit. So that's where I asked the mayor to do that, and the PAC really we agreed to do that just because we don't want to control all the business at this point because that's not where they are. They identified the positive, they notified the public, but that's not really the breakout. The breakout is from home. So I don't think that from day one they don't have any breakout in the business setting. You have one that positive, but they clean up the business, but really you trace back from public health standpoint, it's at home. So it's very hard to do that. So open to some takeout restaurants so people can take home food and the auto repair and the construction because none of those have to do anything to be positive. This is from home. So I keep telling my patient every day, please protect your family. Don't let just right now people your brother and sister want to come over for dinner or breakfast. Just tell them, hey guys, respect our family.
Curbside.
We see you in about 2-3 weeks or so.
Your breakfast is on the porch.
Yep. That's all you can do.
Thank you, Doc.
Okay.
We got to run because we got public health. We got the territorial epidemiologist, Ann Popotsky, Dr. and Annette. So.
Chris, one more thing.
Yeah.
If you go shopping at Payless or something or cost you less, don't bring your family. One person, please. It just doesn't make sense. I went to Payless the other day, and the whole family is there. Yeah. I mean, come on, guys. You can go shopping one person, so do not bring the whole family. Leave one at home, okay?
Right on, yep.
I
Recon.
hear you.
Doc, you got that military. You got to send the recon guy out, the scout. I'm the scout for the family. I go in and I get the groceries and I take the risk upon myself, and then I'm out. You know what I mean?
I hear you.
You got to go on an
the same
extraction
way.
mission. You got to go into Payless, extract those groceries, and come on out. Because if you bring the kids, what are the kids going to do? They run around, they touch everything. They just, kids. 7:45, we'll take a really quick break. Come back.
I'm actually just even scared to go anywhere. Like.